Hi, my name is Eddie. I'm from Liverpool School, and I'm here to talk to you about how we can use computer games to address challenges in tropical health. So, just so that I understand who I'm talking to here, can I get a show of hands? Please raise your hand if you have at least one game installed on your phone or your tablet. That is more than half, which is absolutely fantastic. Which means I don't think I'll have as difficult a sell as I thought I might. So why am I talking about games? Most of you know, because you have games installed on your own personal device, that they can be incredibly engaging. So they can inspire wonder. They can surprise you. They can make you intensely concentrate on an activity, and they can exhilarate you. All of these portraits are pictures of people that are playing video games. Okay? Now, this shouldn't be a surprise. I mean, this is why we play games, right? They entertain us and they engage us. But the topic that I'm going to focus on is using games for a purpose other than entertainment. So how can we use this inherent quality of games, this engaging quality, to accomplish something else? Well, if we talk about games as learning tools, because a player is actually doing something, interacting with the material, games are just aligned with how we learn best, which is by doing. In a game, we can present a relatively complex scenario to a player, and it allows them to grasp that scenario relatively easily. There are certain tricks that we can employ in games to make the player try and try and try again and be persistent in problem solving. And they encourage empathy by allowing players to take on the role of another individual or another group and see their perspective of the world. And they do all these things. Now, this might look like a whole bunch of fluff to some of you. So for the scientists in the room, there is actually evidence, scientific evidence, that says that games can actually change behavior. And these are actually figures. I didn't put the citation up here, but this is from kind of one of the seminal papers about games and behavior change. It's from Pamela Cato, and they designed a game that was aimed to increase adherence to cancer drug treatments in leukemia patients. So they made this game called Remission, and they had kids play the game, and their primary outcome was, do these kids have higher levels of this drug in the blood 1 month and 3 months after they started playing the game? And that's the top graph there. The filled in dots are the kids who play the game, and then the open dots are the ones that in the control arm. But they also looked at the knowledge of these kids about cancer-related subjects, and that's this graph on the bottom left, and they also looked at self-efficacy. In other words, the kids' own confidence in their ability to know about these cancer-related subjects. And in both of those situations, the people who played the games scored better. Now, this is a kind of a burgeoning field. This paper was published in 2008, and I said it was one of the seminal papers, so there's evidence that's being gathered in the last number of years. But we know that games can change behavior, and they can increase knowledge. So now that we know that, why games? Why are we talking about games for tropical health? Well, as many of you in this room know, we often come across some operational challenge. And it might be something like antimicrobial resistance. It might be something like persistent noncompliance to mass drug administration for LF. And in order to make a bridge over these challenges, the first thing we start with is evidence, and we turn to academia to provide us with some evidence on what are the solutions that we can employ to get over this challenge. And ultimately, we should take that evidence and translate it into some policy change. We change policy, and hopefully we have the desired impact on health outcomes. But what we found is that there is a piece missing from this bridge, and I don't think I need to convince you all of it, because that's why we're all here. That missing piece is communication and understanding. How do people understand the evidence, and how do we actually translate that into policy change? Now, we know that games have actually been used to change behavior and increase knowledge in many different fields. The term serious game was actually coined in 1970, so they've been around for a long time. They've been used in the military, in the medical field, in business, but they haven't really been used in the field that we work in tropical health. So we said, okay, we know this about games, and we know that we need to fill this communication gap. And so we had this light bulb moment, why don't we use games to do that? So we started the ETCH Center at the Liverpool School of Tropical Medicine, and that stands for Engaging Tools for Communication in Health. And our overall aim is to develop, deliver, and analyze the value of digital solutions for training, communication, and engagement in public health. So here's our approach. We are kind of involved in all aspects of the pipeline. So we first will obviously engage with our target users and our stakeholders. And we'll also engage with the other side of the spectrum, the subject experts, because they're the people that we need to inform the design of the game. And then we will work with a software development company to actually build a beta test version of the game. And once we have something that's playable, we'll go through many, many rounds of testing, getting feedback from users, refining, until we have something that we think is a final product. And then after that, we are also involved in the evaluation of what that game actually does. So we'll go out to our target users, we'll have them play the game, and we'll have certain outcomes that we need to measure, whether it be some actual change in behavior or an increase in knowledge. And ultimately, we also want to be involved in how to actually deliver these games after we have the evidence that they actually work, hopefully. We want to be involved in how to sustainably deliver those games to foster the kind of behavior change that we're looking at. So just to give you a flavor for some of the projects that we're working on now. This first game was designed to kind of overcome the challenge of insecticide resistance for vector control programs. There is evidence, there's an evidence base out there that says that there are certain strategies that vector control programs can use to decrease the spread of resistance and to mitigate its impacts. But the fact of the matter is that those strategies have not been used operationally in many settings, although they're slowly starting to be adopted now. So our initial aim was to target these vector control programs with a simulation which would allow them to make mistakes in a fictitious world. So the player takes on the role of a vector control program, and here you can see a screenshot where they can interact with a whole bunch of different geographical locations in this fake country. And for those of you who have not played simulations before, it's basically about managing resources and making the best decisions with the resources you have. So the ultimate goal is to keep that provincial health bar up high, while at the same time working within the constraints of a particular budget. And the player can do a whole bunch of actions. They can decide how they collect mosquitoes to monitor mosquito populations. They can decide what types of methods they're using to monitor resistance. They can choose what types of interventions they deploy and what insecticides they use. And after they're collecting all this data, they can see what the data is in this data visualization component. So the idea is that a player can make decisions in a safe environment and see the impact of those decisions in this real-life scenario. Our second game that I want to talk about is called Resistance 101, and this was really to underpin some of the decision-making processes that surround insecticide resistance management. So this was to teach people about some of the fundamental biological aspects of insecticide resistance. And this is more of an arcade game. So for those of you who have played something like Angry Birds, it's set up in a level-like structure, and that's in the upper left-hand corner there. The first thing that a player sees is some video clip of some aspect of the biology of insecticide resistance, and then they have to use that knowledge on a real population of mosquitoes, and that's that large picture that you can see there. Each mosquito has a different type of resistance, which are the color codes around the outside, and the player gets to choose which insecticide they deploy. And here's a picture of a weapon being deployed on those mosquitoes. You can see that some of them are resistant, which is depicted by that green R. And the ultimate goal is to kill the mosquitoes as fast as possible. The faster you do it, the more stars you get. And because this is a learning game, we also have embedded at the end of all the levels a feedback screen, which tells the player exactly what the decisions they made and whether that decision was good or bad and why, and how they can improve it on the next time. And the last game that I wanted to talk to you about was something totally unrelated to insects and vectors at all. This was a project in the Philippines that's focused on HIV. And the ultimate goal, the ultimate aim of this project is to increase the number of MSM who know their HIV status. So it's encouraging people to go to the clinics and get tested. This is a Connect 3 combat game. I don't know if many of you have played Connect 3 games. It's basically where you make a match of 3 like icons, kind of similar to Candy Crush Saga. And in this particular game, the player aims to create matches of weapons, which they then deploy against an enemy at the top there. It's also a role-playing game because the player is presented with scenarios before they start playing. So the first scenario might be very easy. A patient goes to a clinic, gets tested, happens to test positive, but tells their family and friends about it and takes the appropriate medications and does all the right things. And in that case, the enemy is really easy to destroy. But then as the game progresses, the scenarios that the player is presented with get more and more complicated. The individuals that they're dealing with display more risky behavior, and the enemy becomes more difficult to destroy. So those are some of the things that we're working on now. I realize that my time is short, so I'm going to call it quits there. I do have a table set up upstairs, and I have some tablets if you do want to try your hand at some of these games. I have the Resistance 101 game and then just a snippet of the simulation as well if you want to play that. So thank you very much.